Hello, everyone, and welcome to the Maes Medical Minute. My name is Jacob Otto, and I'll be your host today. We are back here again with Dr. Maes. How are you doing today?
I'm doing great. Thanks, Jacob.
Thank you. I just wanted to say I appreciate you taking the time again to come out in here and talk about some stuff that can really save people's lives and help everybody live a healthier life. With that being said, we're coming up on the new year, and everybody's going to be focused on these New Year's resolutions that they go to the gym for 30 days, maybe 60 days, but kind of trying to prioritize these healthy changes in their lifestyle. Is there anything you would recommend for like the top health resolutions for adults?
Probably some of the easiest lifestyle changes to make is just exercise. And I know that we talk about doing that, and I think everybody's like, that kind of scares me a little bit because I'm not going to be able to maintain it. But with the new year, that's one of the easiest times. It's been shown that people are able to actually stick to their exercise program. Even if you only make it through half the year, and you restart again next year, that's okay because you're still going to get some benefits from starting that exercise program. And it doesn't have to be a lot. We're really looking at 30 minutes a day or 150 minutes a week. And however you do it, it could be light walking, anything you can do that just kind of get your heart rate up. We know that we want to get a little bit of resistance training in there, but again, it doesn't have to be the heavy free weights. It could be just resistance training because that's going to help with our bone density. So doing something as simple as that, just a little bit of exercise, will definitely help keep you in shape and get you into shape. And then the other thing is just kind of go in moderation. With moderation, if we're drinking or we're smoking, you don't have to stop cold turkey, but even if we can decrease the amount we're smoking, so if someone is smoking a pack a day, just being able to get down to half a pack a day, the goal is long-term to get them off the cigarettes, right. But a lot of times asking someone to just stop smoking is an impossible challenge for them, at least mentally, for them to do that. So if we can get them to just decrease the amount of cigarettes they're smoking a day or vaping. Same thing with alcohol. It's been shown that 1 drink a day for women and 2 drinks a day for men is really the cutoff. And above that, you're starting to do damage to your body. So all of those things are pretty easy to do. We just need to limit the behaviors that we're already doing, and you'll have a definite benefit from it.
So maybe not just cold turkey. A lot of people say the only way to do it is just to stop it, but take that first step and just reducing it will make a huge impact on your health.
Yep, absolutely.
Awesome. So what screenings or checkups should people prioritize in January?
Definitely. I think the one screening that I encounter the most in clinical practice is I talk to women and they all know that breast cancer screening is important. But I think after they've had 4 or 5 normal mammograms, they kind of lose track of doing it. And they think, oh, I don't have to worry about it because it's always been normal. And that's great if it's always normal. We want to do the screening every year, though, so we can make sure that we're screening for breast cancer. So that's something that's super important that we have a routine screening of. Getting your physical exam with your clinician, just getting a checkup every year. This is another good time to do that because we don't do those regular checkups. We only go to see clinicians when we're sick. Right. But if we go see them and just get an annual checkup, they can kind of make sure everything is working right on you and that you're healthy. It's kind of like we take our car in to get a checkup, but we don't take our body in to get a checkup. And that's something that's really easy to do, and then reviewing your medications, so if you're on multiple medications, it's a good idea to review those at least once a year with your doctor to make sure that you're not taking 2 different drugs that do the same thing, that you're not taking a dose that's too high or too low for you, especially in this age where patients tend to see multiple doctors. And so they may have been started on this drug by one doctor and another drug by another doctor. And there's not always a lot of communication there between the 2 doctors. And so if we can review that at least once a year to make sure that you're not taking anything that's going to cause you some harm. So those are a couple of the really easy things you can do every year.
Fantastic. So another thing you're going to see a lot of people start going to the gym. Maybe they do start lifting heavy weights or something. They're going to start taking supplements. Is that something they should review with their doctor before, like going all out on a pre-workout or something?
Yeah, that is something that comes up every once in a while. It seems like people are taking a lot of supplements. They don't even necessarily know what's in it. And I think, as long as we're doing it in moderation, it's probably not going to hurt you it's not going to cause you any long-term damage. But if you are taking a significant amount of supplements, if you find that you're taking 2 or 3 or 4 different products a day, then I would definitely review that with your physician just to make sure, if nothing else, you get your kidneys checked, you get your liver checked with lab work, just to make sure you don't have any health problems that are going to make those supplements worse for you.
All right. So one other thing, I mean, I've even personally done this. I'm like, hey, if I just go to the gym and I walk on a treadmill for 30 minutes every day, get my heart rate up, my heart's going to be stronger. Is that accurate? Or
Yeah. Even, just light exercise, just getting your heart rate going above what it does at a basal level is going to provide you some health, and it's going to provide you some benefit. Really the benefits of doing all of this exercise, we think about the weight loss for sure, and just losing a little bit of weight makes a big difference. But just getting your heart healthy enough that it can handle some stress. We don't want to be to a point where walking up a flight of stairs is getting us out of breath.
Right.
And if it is getting you out of breath, then that's an indication that you need to do a little bit more activity. And again, it doesn't have to be super heavy activity, but if you can just get to a point where you're doing that 30 minutes a day of walking, then going up and down those stairs are probably not going to cause you a problem.
Is there any screenings we should pair with those type of goals so we can maybe, instead of just, I'm going to go and I think my heart's getting healthier, is there a way to track that or anything?
Yeah. So there's a couple different ways that we can track how healthy our heart is. The one that we do here at Health Guardian is the cardiac calcium score. And so that one's really important because it will tell you how much calcium you have on the vessels that are supplying the blood to your heart. So it's really a test that can test how much damage is already occurring, and without you having to go get an angiogram and things like that. We get the lipid test that everybody has done every year, and that really is good at assessing your risk for heart disease, but it doesn't see the actual damage to the vessels. And the cardiac calcium score is one of those first tests along the pathway that can actually start telling you, okay, this is something abnormal that we're actually seeing in the vessel. And so that's a really good one. The other thing we can do is an echocardiogram and an EKG. So an EKG is just testing the rhythm of your heart, and a lot of people present, the first time that they presented, they're presenting because, oh man, I'm kind of short of breath, I'm out of breath a lot, and they go see their doctor, and we do the EKG, and they have an arrhythmia, whether it's atrial fibrillation or something different. That can be the first sign that you're having problems with your heart. It's not necessarily chest pain. So if you're having that arrhythmia and your heart is just beating too fast all the time, your heart doesn't have enough, because it's beating so fast, it can't get the blood flow out. And so every time it pumps, it's not as efficient as it would be if the heart rate slowed down. So even doing something as simple as that and getting the EKG and making sure that your rhythm on your heart is okay is very helpful. And then the echocardiogram is the ultrasound of your heart. So that's looking for any kind of structural problems, anything that, the chambers of the heart are too big or not working efficiently, they're not pumping hard enough. Sometimes the blood, even though you're pumping it in the right direction, a lot of it kind of flows backwards, it regurgitates. And so being able to evaluate that, there is definitely medications that you can take that will help treat those problems for you.
And that's something exercise will also help, or?
Yes.
Okay.
Yeah. And anytime, if you have a history of heart disease or chest pain or anything like that, it's always good to see a doctor first. Get checked out, make sure you don't have the arrhythmia before you take on a big weight loss program or an exercise program. Make sure that you don't have any problems with your heart before you start doing things like that. Because if you do, you definitely want to take it a lot slower.
Okay, so we understand like walking is going to help us. It's going to help with weight loss. A lot of people are getting on GLP-1. They're losing weight at rates probably not super good for them. Is there a limit we should be looking for? Let's say I get on the GLP-1, I'm working out all the time. Should I be monitoring my weight loss and say like, hey, maybe this is happening too fast or too slow? Or
yeah, the great thing with the GLP-1s is they work in several different ways. They suppress our appetite, so we're not as hungry as we were before. They make us feel more full in our stomach. They also improve the ability of our own body to utilize the glucose by regulating the insulin. And so that's a super good benefit of those medications. But you're right, when you're losing weight, we want to make sure that we're losing the right weight. And so if your body just goes into starvation, you'll lose some fat, you'll lose some muscle, and you could potentially lose bone density. And so just going into a starvation mode when you go on the GLP-1 is not the best way to just lose weight. So you have to pair it with a little bit of physical activity so that you're getting some exercise, and you also want to make sure you're altering your diet. So if you're on a GLP-1, you want to increase your protein content that you're taking in so that as you're losing weight, you're not losing muscle. And the way we can kind of check for that is doing the DEXA scan, which is a really good screening exam. And it will tell us exactly what our body composition is, what our percentage of fat, how much muscle we have. If we're losing too much muscle and we're starting to get too lean, then that's an indication we need to have a lot more protein in our diet. And so the GLP-1s are a great medication to help you lose the weight. But again, we want to do it in a safe way, and we want to do it in a beneficial way to the patient so that they're not going to become more unhealthy in the long run because of that medication.
All right. So another thing, and I'm probably guilty of this, a lot of us are guilty, probably since Thanksgiving, I've just eaten way too much food, too many sweets, too many sugars, whatever it may be. What is the best advice for maybe dialing that back into a healthy manner? And is there any consequences if you just cut anything like that off?
So, nutrition in general, our biggest problem is we just overindulge. Mm-hmm. And so whenever you're trying to get healthy, you're trying to lose weight, I think a lot of us say, okay, I need to just starve myself. And that's probably not the best place to start. It's not sustainable and it's miserable. So an easier way to do it is when you're eating a meal, eat half of what you would normally eat, and then wait about 10 minutes. And if you're still hungry at the end of that 10 minutes, then you may eat a little bit more. But more often than not, you'll realize that, hey, I ate half as much as I would normally eat, and I'm actually really not that hungry. And so that's a good way to start limiting your calorie intake. So you're not necessarily having to count calories. You're just counting the portion size. So you would get that normal portion you would normally eat and cut it in half. And try eating half of it. And that way, you don't have to cut everything out cold turkey and make it miserable for yourself, because you're a lot less likely to be able to sustain something when you just cut it out completely.
Okay. Does that go with, let's say, these fad diets? I know there's a lot of talk about carnivore, keto, liver-only diets, or whatever social media might come up with. I think I even saw a commercial the other day talking about like hot dog-only diet. I think it was a joke, but are those diets safe, or is there a purpose behind them, or is that legitimate science in there?
It depends on why you're doing that diet. I would say any of these fad diets have their short-term goals, but they're not good to be on long-term. So even if you look at the keto diet, which is a really high protein diet and a very low carb, if no carb diet, that's good at losing weight quickly. And it's kind of like being on the GLP-1. Okay. You're able to lose weight pretty quick, but then after you get to a certain weight, you need to go back to eating a healthy diet. So even if you're doing the protein diet where you're eliminating the carbs, at some point you have to start adding the carbs back into your diet. Otherwise, you're going to be unhealthy. So it's great for losing the weight up front, losing it fairly quickly, but then you have to make sure that you add the nutrients back into the diet that you need. And there's some diets that are certainly better for you than others. Right. I certainly would not recommend an all hot dog diet. But I do know where they're coming from. One of the diets that's really popular right now is called the MIND diet, MINDS, or the Mediterranean diet. And that one's been really, really helpful for people. It's really good for people with dementia, especially. Okay. And so it's a diet that's really high in leafy vegetables, fruits. If you're going to, you definitely still have to eat the protein, but it's better to have more fish and poultry and a little bit less meat. So those are some of the big things that the MIND diet does for you, but it's been shown that it really helps patients slow the dementia.
Oh, that's good to know. I didn't know that what you eat could slow that. So we talked about transitioning food. Another thing a lot of people get into is alcohol. There's a lot of socializing during the holidays, and then they do dry January. Is just the cutting off all alcohol, is that okay?
If you are if you're going to stop drinking, certainly it's beneficial to stop drinking. But if you're a heavy drinker and you're somebody that's drinking 3 or 4 drinks a day, and then you do just cut it off cold turkey, that certainly could be bad for your health. So you can actually go through withdrawals. And there's a lot of people that don't even realize that their body is dependent on that alcohol. Right. And the withdrawal process itself can actually be deadly. And so you want to do it in a safe manner. If you're drinking a couple drinks a day, going cold turkey like that and just stopping it for a month it's not gonna affect you as much. You may find that you do a lot better without it and decide to sustain that longer than a month. But it's really the people that are heavier drinkers. So if you're a female and you're drinking 2 or 3 drinks a day, or you're a male that's drinking 4 or 5 a day, even if it's like 4 days out of the week that you're drinking that much, I would try and cut it down in half before I go to the complete dry month, just to make sure you don't go through any kind of withdrawal.
So kind of just that first step if you're in the heavier side of it instead of just cold turkey. All right. diabetes, hypertension, things like this, they get a lot of attention just because of obviously the significant health effects and life changes that come with them. What resolutions can a person do to kind of help if they do have diabetes or hypertension?
Sure. So, that also brings back to the importance of doing the annual screening. So, controlling your blood pressure is certainly going to be beneficial for you. The high blood pressure is one of the most common causes for people to have kidney disease or kidney failure. So we want to make sure we're controlling our blood pressure. Our blood pressure being elevated can lead to strokes. It can lead to heart disease. It can lead to all kinds of problems. So keeping your blood pressure in control is certainly going to be very beneficial. If you're a diabetic or you're a pre-diabetic, the lower we keep our blood sugar level, the better off you're going to be in the long term. So if you're a pre-diabetic, and so if we were looking at someone's hemoglobin A1C, which is another screening test we were able to do at the Health Hub Clinic, we would be able to test the hemoglobin A1C and tell if you're a diabetic yet or if you're in the pre-diabetes stage. And a lot of times, if you're in the pre-diabetes stage and you lose 5 to 10 pounds, that is enough that will get you out of that diabetic risk. And so, a lot of people think, well, I'm pre-diabetic anyway. I'm just gonna accept that fate. But the reality is, if you're pre-diabetic and you haven't become a full diabetic patient, it's still fairly reversible at that point. So by losing weight and starting some exercise, those kind of things, you're able to hold it off or prevent it altogether. And so that's really important to even maintain a normal blood sugar level is pretty valuable.
Awesome. The last thing I've got as far as resolutions and everything is we often start working out, eating better, we're losing weight, we plateau off maybe, but the person we're doing it with just keeps going and they're improving, and there's maybe a mental side effect to it. Can you explain maybe the ways to get past the plateau and keeping your mental health up while you may not be getting the goal or the results you want?
Yeah. So that's one of the important things that one of our partners that we work with is they have something called a VO2 machine. And so that's very helpful because it can tell you what kind of metabolism you have. And so if you're the kind of person that their metabolism requires 2,000 calories to maintain homeostasis, but the next guy, your buddy next to you that's working out only requires 1,500, he's going to become a lot more lean than you are when you guys are doing the same activities because he's going to lose the fat right away and then he's working on building muscle. Whereas for somebody that requires a lot more calories or a lot less calories, it's going to be a lot more difficult to do that. And so the DEXA scan and the VO2 machine, really combining those together, you can look at the percentage of muscle that you have in your body, the percentage of fat. You can make sure that as you're lifting weights, you're holding on to that muscle. And with the VO2 machine, it's able to even give you some nutritional information. So it can tell you, for you to gain weight, especially to gain muscle mass, this is how much protein you need to eat. So for you to gain muscle, you may have to eat twice as much protein as your lifting partner or whomever you're exercising with. But we don't know that if we don't do the VO2 machine. So, it's always frustrating. You see those guys that have been working out time after time and they haven't really gained much muscle. They'll eventually get pretty slim, but they don't gain the muscle mass. And it's just because they're not getting enough protein in their diet. To gain protein or to gain muscle takes quite a bit of protein to do that.
Awesome. So comparison is the thief of all joy, but there is medical ways to get maybe that information to get you to the next level. Yeah. Anything else you want to talk about as we head into the new year?
Yeah, no, I think that's a great start. The main thing is just for patients to remember, let's get in and see your doctor. We want to have the opportunity to have someone check you out. That's your opportunity to get in there, get your blood pressure checked, get your blood sugar checked, make sure you're on the right medications, discuss a weight loss plan with your physician if you want to do that, and certain ways that we can do it in a more healthy way than others. And then, like I said, those activities that we do that are detrimental to our health, like smoking and drinking, we want to just think about limiting those a little bit. Even if we can't stop completely, if we can decrease it, it's certainly going to be beneficial for us.
Fantastic. Before you go, I do want to stop. I'd take the time all the time to say I appreciate you giving out all this information and letting all of our listeners and viewers know that there is ways to live a healthier life and it's not all scary if you come into the doctor. One of our listeners, Carlos, stopped in and said that this is an excellent service and he appreciates it. So I just want to let you know that those viewers and listeners are appreciating what you're doing here.
Thank you, Carlos. I appreciate that.
All right. Last thing, we're going to talk about where we can find Health Hub Clinic in Springfield, Missouri.
Okay. Health Hub Clinic is located about 2 blocks from the medical mile here in Springfield, Missouri. We're on Bradford Parkway. There's a McAllister's and a big bank on the corner. But if you come down the street, we have a pretty good size sign that you'll be able to see us. But we have the Health Hub Clinic, and then we have the Health Guardian Imaging right next door. And so we work very closely together. That provides us to give the direct primary care to all of our patients, and then it also allows us to do any kind of diagnostic imaging we need to do to take care of things if they have a health problem, or any kind of screening examinations to keep people healthy and prevent illness.
Awesome. And Health Hub Clinic is also available online at healthhubclinic.com. And then you can ask Dr. Maes questions. As we continue to get more feedback and questions from the listeners, we'll add that segment into the end of the podcast. AskDrMaes.com is where you can leave us feedback or ask questions. That's AskDrMaes.com. And we'll put the links to Health Hub and Ask Dr. Maes in the show notes. Thank you, everyone.
Very good. Thank you.